CEO and co-founder. Joining me is Dr. Michael Fine, the former Director of Health to the state of Rhode Island. Dr. Fine, thanks so much for taking the time today.
Always good to be with you again, Josh.
Okay, Dr. Fine, numbers are up and away over the past about 4 to 5 weeks. Let's just go over some of them. Transmission rate. The state's action level is 100 per 100,000 Rhode Islanders over a 7-day period. We're running at 583.6 as of yesterday afternoon.
It's nuts. I mean, I think it's basically doubled in a week, and I don't see anything that's going to slow it. This will march forward unless we do something to change it, and I don't see us doing that at all. Now, people need to mask inside. Everybody just needs to mask inside. That's as simple as I can put it. People should be staying away from large events. There's no other way we're going to control it. We need to be testing more rigorously than we're testing, in a way more organized way. And I'd love to see us do those kinds of things to get control of it, because we're going to have a very tough December, and I fear we're going to have a pretty hard January as well.
Yeah, let's go to cases. 875 yesterday. We're running at over 800 to 900 now on a daily basis on significant testing, but not overwhelming testing. Those numbers are going to catch up with us, as we all know. Cases, some portion of them translate into hospitalizations. We'll go to that in a second. And then some portion of those turn into deaths.
Yeah, and that's what we're going to see. We continue to see hospitalizations lag a couple of weeks behind deaths, but now we're over 200 people in the hospital. And I really fear that we're going to start looking at 8 to 10 deaths a day over the next 2 or 3 weeks. It's a heartbreak.
Yeah, we saw 53 deaths in November. We're running at about that pace right now, but now we're seeing the hospitalizations turn way up. So we're going to see at the end of the month, deaths start to mount coming out of all those hospitalizations. I think January is going to be the horrific month. End of December, beginning of January.
And these are all preventable deaths. They were predictable, and they are all preventable. And Josh, that's what keeps me up at night.
Dr. Fine, let's go to hospitalizations. Last week, we broke a story about a presentation made by the epidemiologist for the Department of Health, John Fulton, who's now over at Brown University's Warren Alpert Medical School full-time. He's helping the Department of Health as an epidemiologist. Longtime veteran, as smart and experienced a guy as going. He told about 200 doctors on a Zoom call that in a few weeks, we might pierce 175 hospitalizations, and that's the danger zone. That's really the limitation of what the hospitals have right now because of staffing shortages. Well, we're at 203 as of yesterday.
Yeah, and I fear we're going to see that number double, based on the pattern that we've seen in terms of the rapid escalation of cases. Again, we're not doing anything to slow those. I think all of us heard about the URI PC game at the Dunk, where there were 13,000 people, many of whom unmasked. That's a recipe for disease spread. We're doing a really good job spreading this disease, and not any kind of job slowing it.
Okay, walk us through sort of the functionality. If you're talking about, and we've kind of confirmed that number that John Fulton talked about, that 175, that's sort of the limit as to what Rhode Island's hospitals, they're down significantly in staffing. It's no secret, Lifespan has over 2,000 jobs vacant right now. Nurses are jumping from place to place for big signing bonuses. But there's no new nurses, there's just less nurses as we go along through this pandemic. People are burnt out, they're quitting. How do the hospitals, besides pushing off elective surgeries, which now they're doing at a significant pace, how do they manage an explosion like this? Less staff, more patients, capacity exceeded.
You start to see crisis standards of care, where people do things differently in order to stretch the resources that they have, and try to make them go further. Sometimes you see triage where somebody won't be treated because they're less likely to survive. And those are the kinds of decisions you have to make when you don't have enough staff to do the work. It just boggles my mind that we are back here again and that we're not taking care of our healthcare workers who have been heroic through this. Josh, we should have, in order to take care of our healthcare workers, we needed to stop the spread of this disease in August and September, and we totally failed. We have abandoned my colleagues yet again.
Dr. Vina, when Megan Ranney, you shared it with me. I hadn't seen it. Time Magazine guest piece by her. She was GoLocal's Woman of the Year last year. She's been a national voice on this, emergency room doctor, leading expert on gun violence issues in healthcare. She also runs the digital center between Brown and Lifespan. A remarkable woman. She's really hitting the panic button on hospital staffing. Walk us through what she raises as an issue and what the solutions are. I think everybody realizes we're in a world of hurt, but what's the solution to some of these issues?
Well, the solutions are difficult. On the one hand, obviously, it's better control of the disease. On the other hand, it's taking care of and resourcing hospitals and healthcare workers better. We are trying to do this on the cheap. When you look at the enormity of the task before us, we need to double the size of our medical and nursing schools. We needed to do that. I worked on that 10 years ago when I was at the Department of Health. We need a medical school that's twice the size of what we've got in Rhode Island, focus on training people from Rhode Island's communities to be our primary care physicians of the future. We need to build up our primary care sector. We need to resource our hospitals better. We need to double and triple the size of our nursing programs so that we're training new nurses, because nurses get tired. They work so hard and give so much of themselves. We just need to do better and more of it, and we need to commit ourselves to it. And that just hasn't happened even in the face of this pandemic. It's amazing that we've sort of seen it in front of ourselves and walked away from it anyway.
Let's shift over to the booster. A lot has been said about the need for the third shot. It was a critical element to really getting people fully vaccinated prior to the unveiling of this new variant, the Omicron variant. And the Omicron variant is demonstrating in its early discovery some dynamic elements to it, more contagious, but also looking like not as deadly a variant as the Delta variant is. And that's early data, about 3 weeks of computations and looking at what's happening in South Africa and looking about its spread around Europe and now the United States. Pfizer, who, as I like to say, has the best PR machine in the world, even better than the White House's. I mean, it's pretty remarkable. Data was coming out that it was not very effective with 2 shots against this new variant. And then just days later, they hit CNN and everywhere else with press releases and talking heads that showed that they were wildly effective with 3 shots against the variant. What should we make of that? And should we pause a little bit? A lot of media picked up. We did not write on it. From my standpoint, really want to see where Moderna comes out, and also that the sampling size of this analysis is a little bit bigger than what they presented this morning. Talk about this dynamic and what the average person should be thinking about before they make a decision.
Well, as I've said sometimes, once in a while, I'm cautious about science by press release. So I appreciate their interest in selling their product, but I think many health professionals had the notion that Moderna might be a somewhat better vaccine before we went into this. Clearly, the evidence is now clear that a third shot makes a huge difference, and everybody should get one. How much the evidence favors one over the other. I haven't seen evidence that favors one over the other, despite Pfizer's intense push. What everybody needs to know is please go get your third shot, and please go get it today if you haven't had it already, and keep your eyes open. You know, I don't know whether and when we'll need a fourth shot, but for right now, please get your third shot today, because this disease is all over the place.
Should the education coming out of the White House, from the governor's office, from governor's offices around the country, from CDC, FDA, the World Health Organization, does it really need to start changing that these things aren't final solutions. There's a progression, and that we need to get into a mindset of understanding that we're going to live with this for years, and that there's going to be a series of treatments that is going to keep us healthy or healthier than being untreated. And we need to have the flexibility and the adaptability to be able to address it. Because I look at the comments of every time we publish a story, and it's like, well, that's not what the CDC said last month. Well, the CDC didn't know this last month. The variant was only functionally discovered about 2.5, 3 weeks ago. There's going to be a progression throughout the next few years, and hopefully that the final decision isn't that there's a deadly variant that is also contagious. How do we change the mindset of Rhode Islanders and Americans and the globe to understand that this is going to be dynamic for a very long time?
Well, I think we have to be absolutely honest in our communication about what we know and don't know. I mean, I'm learning about this all the time, so is everyone else. You know, my colleagues around the country who are way more famous than I will ever be and way more knowledgeable than I will ever be are saying the same thing. You know, they're saying we're learning about this every day. So we shouldn't be sort of making final pronouncements on the one hand, and people shouldn't expect them from us on the other hand. We are in this together. We're learning about it together. You know, as we learn, the idea is to report what we've learned. You know, I'm now trying to get across the idea that the vaccine is great at preventing hospitalizations and deaths, but it doesn't prevent the spread of the disease. We have to do other things to do that. I learned that over the last 2 or 3 weeks watching the numbers. And I think as we learn, we have to be clear, and that's what many of us are trying to be, and that's what we have to work harder at.
Yeah, I mean, just for those watching, I don't know what the total number of emails internally at GoLocal between our team on this. There's 5 of us who work on this every single day, seems like every day. But it's probably 20 or 30 emails back and forth so far today relative to studies we're seeing, information we're detecting, et cetera, trying to get a beat on where this thing is and where it's progressing to. So it's a dynamic, and what we knew 2 weeks ago is all changed 2 weeks later. So one of the other things I want to suggest is forget government for a second. We all know the strengths and the weaknesses of government by the best leaders and the worst leaders. What is it that each of us should do right now to make sure we stay healthy and keep our families healthy?
Well, the thing that, the things that jump out at me are make sure that you've got the third shot. That's the first thing. Make sure you get the first 2 and the third. Sure.
I just want to interrupt here. I've given up on the people who haven't gotten the first 2. I don't want to spend a lot of time. It's been a year almost. It's been almost exactly a year since the first. Yeah, right. It was December 14th, so we're just a week away from a year. If you've decided you're not going to get the vaccine, I'm not going to spend a lot of time trying to convince you or educate you on it. Well, let's focus in on the third shot.
Yeah. Well, everybody who got the first 2 should get the third. You know, the vaccine protects the people who get it, and if you don't want that protection, that's up to you. But the third shot makes that protection most complete. So, third shot, mask whenever you're inside in a public place. That, to me, is critical. It cuts disease transmission by 50%. That's a big number. I think if you are out and about and in contact with others, you should test twice a week. I think if you're going to get together with other adults or kids now who are vaccinated in a party or a bigger group, I think you should use a rapid test on the way in, and that will tell you whether anybody is likely to be transmitting disease. Those to me are the really big things that everyone can do together and should do. I don't think we now have agreement that vaccines reduce the need for masking. You can reduce the need for masking by rapid testing before you get together. These are things we can all do together. They're pretty simple and very effective.
What about outdoors? We ran that video at the beginning of the pandemic. It was a JAMA video of a sneeze, just any sneeze, and how far a sneeze or a cough travels. It's about 20 feet. If I'm going to a Patriots game, cold weather, outdoor, but a lot of people around me, do I need to wear a mask in that environment?
I think if there are lots of people around, I would, to be honest. This doesn't cost you anything. If you're like me, it clouds up my glasses a little bit and I don't love it. But when there are lots of people in one concentrated place, it is a recipe for disease spread. Early on in the pandemic, it really looked like there was a fair amount of disease spread as people were walking around in Venice, Italy. There was apparently some disease spread in the Rose Garden outside. So it's not like it can't happen. If you're going for a walk in a park by yourself or with one or two other people, I don't think you need a mask. But if you're at a Patriots game and there are 75,000 other people there, if it were me, I'd do it.
And Dr. Fine, should we start to really break away from the expectation that government is going to find the solution to this pandemic? Listen, I don't think anyone is malevolent in government at the state or federal level, regardless of CDC's failures or the state of Rhode Island's failures. Isn't it time that sort of individuals need to step up their game? They've got to read some of this data. They've got to make some analysis. I'm hearing that the percentage of parents who have gotten their 5 to 11-year-olds vaccinated, which was approved a number of weeks ago, is an incredibly low number. I don't want to give out a false number, but in Rhode Island, it's an incredibly low number. The data is pretty darn clear that it is wildly beneficial to your child's protection in avoiding getting infected and potentially having a long-haul symptom that could affect their longer-term health. Where are we with this?
I think it is what each of us chooses to do every day that's going to matter. I'm spending my nights reaching out to people I know and organizations that I know to try to help them understand how they can protect themselves and their membership or constituencies. I think we need to do this ourselves. I don't think government can do it by itself or is really going to get us there. This is something we all need to do together and expect of one another.
Dr. Michael Fine, thank you. We'll have more numbers up. If you haven't seen it, since Saturday, we've been running a daily update on COVID. It has all the relevant data, both from the state of Rhode Island and analysis and data from the New York Times as well. That should give you a sense of where the virus is going and the rate in which it is increasing right now or maybe decreasing in the future. Nationally, the numbers are not helpful either, but the Northeast is getting slammed the hardest. It has got the greatest increase in the number of hospitalizations. It has the greatest increase in the number of new cases from a percentage standpoint. Rhode Island is at the forefront of that, either 1, 2, or 3 in each of those categories right now. Thanks for joining us. If you haven't gotten boosted, go get boosted. If you haven't gotten vaccinated, don't know what to tell you. Thanks, everybody. Stay healthy.
Thanks, Josh. And thanks for keeping this on the front burner. It's important.